All right. Hello, first year students. My name is Sydney, and I've got Taylor and Paige here with me. We're going to be presenting to you today on professional behaviors and expectations in the clinic. So just a little bit about us since we're not in person and it's hard for you guys to see us. My name is Sydney Glenn. I love to bake. I enjoy camping as well as golfing, even though I'm not good at it. And I hope to work in the neonatal care setting once I graduate.
My name is Paige Stemler, and I have lots of cats. I am a cat person over a dog person, although I also love dogs. And in my free time, when I'm not studying for school, I enjoy hiking and being outside, especially in the summer. And I would really like to be a traveling home OT.
Hi everyone, I'm Taylor. I really love the warm weather and sunshine, like I'm sure most of you love also. I also really enjoy playing softball. I've played it since I was about 3 years old, and my dream setting in the future would be with pediatrics.
So the purpose of this lesson today is to educate you guys, the first year MSOT students, on professional behaviors that you will be expected to demonstrate not only in the clinical setting in the future after you graduate, but they're expected of you in the classroom as well from your professors. And some of the learning objectives that we're going to talk about today that we are going to cover throughout this lesson. Before you start listening to us right now, you should have completed a pretest so that we know how much you know about the professional behaviors. And then after the pretest, you're going to be listening to this lesson right here, identifying the level of comfort with the content by ranking your confidence on a scale basically at the end of the quiz, which you should have already completed. And then after you listen to our lecture now, each student will identify the proper professional behavior for each description given with at least 75% accuracy. And then after this lecture, you should be able to demonstrate an appropriate and an inappropriate example of your assigned behavior that we'll talk about a little bit later. And then we want you guys to try to view a video of each professional behavior, and then you can identify which one you think is the most important in the clinical setting and why.
So what are professional behaviors? So we have that qualities and behaviors that are attributable to a mature and effective therapist. So why are these professional behaviors important? So these professional behaviors are vital to the success of each student occupational therapist, the Department of Occupational Therapy, and the occupational therapy profession. So you'll be critiqued on these behaviors in many of your MSOT classes and during the fieldwork experiences that you will have in the future.
So with our first professional behavior is ethical behavior, and this is probably one of the most important, hence why it's number one. It's important that you adhere to the Occupational Therapy Code of Ethics, which I believe you'll be getting a presentation on as well during these modules. It's also important that you abide by the facility and college policies and procedures. These are not only at SVSU, but also at your fieldwork rotations, as well as where you end up working in the future. You also need to be able to maintain client confidentiality, as well as be an honest, compassionate, courageous, and have continuous regard for all who are involved with you throughout your clinical experiences, as well as in the classroom. It's important that you seek informed consent from all of your clients, especially when you ask to touch them or share information with other individuals about their condition, and that you present with a professional image throughout when you're working with clients and in the clinical setting. With dependability, it's important that you're able to establish trust in your relationships, build confidence for your clients, as well as show confidence in yourself. Develop a dependable life and work style so that people know when they can count on you for information, for being there for them, etc. And identify and acknowledge problems for change. So your group that you're working with can depend on you to acknowledge those problems and change them when needed. You also should be able to be viewed as trustworthy by your peers and model appropriate behavior. So we've got our first stop and reflect question here for you. We ask that once you read this question, you take a moment to pause the video and think about what your answer would be to the question. So the question is, why do you believe the professional behavior dependability is so important as an occupational therapist? So pause the video for a second and come back, and I'll give like a little bit of a discussion on it. All right, so hopefully you came back. It is so important to be dependable as an occupational therapist because you're going to have clients, coworkers, family members, other health professionals that are going to be relying on you to be trustworthy, complete your work timely and to the best of your ability. So it's really key that you're able to be that dependable employee, role model, etc., for those that you're working with.
So the next professional behavior is going to be your professional presentation, and this includes awareness of your image, not only the way you dress, but your appearance, your posture, your body language, how you're speaking, your voice, and your attitude. This also means presenting yourself in an acceptable manner, using body posture that communicates interest so you're not slumped back in your chair and acting disinterested. You want to be able to show that you are professional, you are there, and you are there to be a team player. You want to create a positive image. You want to reinforce verbal communication with your nonverbal and your body language. And you want to use your appearance and attire as a professional means to show that you are there to be a team player, like I said. And your posture also shows that you're confident. Like I said, you're not slumped over, you're not wearing pajamas, you want to be in class, you want to learn, you want to be an active learner and participant. Along the same lines as being an active participant, you want to have initiative and motivation. So you want to be curious, be enthusiastic, be energetic, especially when you are in the clinic and you have to be around patients. You want to initiate participation and seek out learning opportunities, and you might have to learn on your own once or twice throughout the program. So you want to be able to take responsibility to motivate and awaken the initiative of others, because some people aren't as motivated as you. You want to make sure that you're able to take that into account. This also means you accept responsibilities for all outcomes, positive or negative. It happens sometimes, but you have to be able to take accountability for your actions and responsibility for it as well. But along with this, you want to make sure you're taking some risks in order to receive the rewards, because some of those benefits outweigh the risk, and you want to be able to be thinking outside the box and going along that line of just having the motivation to seek out those learning opportunities. And you also want to be organized throughout the presentation, throughout the program, throughout everything. Organization is key. So make sure you're always pre-planning, prioritizing your tasks, prioritizing your day, your homework, your clinical load, anything like that. Managing your time effectively, being aware of what is being asked of you in the classroom and in fieldwork, and being able to handle that routine and change without being overwhelmed, because it can be a lot to handle. But if you are organized and you're able to stay on task, then it won't be as difficult. So being able to have that initiation and action, creating the thought process in order to establish like some kind of organization to your life, and being able to put that plan into action and into an order that makes sense to you. And so if you're organized in class and in fieldwork and in the clinical setting, this is going to translate to a more organized lifestyle overall, and you won't feel as overwhelmed in the program and in life with your workload.
So as for the supervisory process, the first concept here would be receiving constructive feedback appropriately without being defensive. So that's not making excuses and stuff like that. Also, modifying performance in response to feedback. So taking that feedback that maybe comes from fieldwork coordinators or professors and taking that into consideration so you can modify it in the future. Also, we have actively participating in the supervisory and student relationship, like I stated earlier, where you are actively asking questions, getting answers, things like that. Also, operating within the scope of your own skills as an OT and student, and asks for assistance when it's needed. So like in fieldwork, if you have any questions, feel free to ask, or even in class, just ask for assistance whenever you do need that. Also displaying respect, and lastly, learning that supervision. So as for clinical reasoning, we have here first the reasoning skills define practice, they determine procedures, identify competence, and measure outcomes, and also ensure growth. So this ensures growth as an individual and as a student and future occupational therapist. Also, clinical judgments, these generate these clinical decisions. It also displays an intellectual process, which includes intuition, judgment, empathy, common sense, theory, experience, and foresight to produce an action plan. Also, this helps visualize possibilities, so different circumstances like scenarios like that. In addition, it produces the best rather than the right answer. So there usually isn't a black and white right answer. It's just what in this situation is the best answer. Lastly, it's making the most informed and appropriate decision possible at that given time. So now we have a stop and reflect. So if you guys want to, you can pause the video and answer these 3 questions. So I'll read them to you. So at what point do you think that occupational therapists develop perfect clinical reasoning skills? Are these skills the same in every setting? And how may they differ? So go ahead and pause the video and write down your answers, maybe on a scrap piece of paper. Okay, so hopefully you guys are back. So I can just go over it here really quick for you guys. So there really is not a specific point where occupational therapists are perfect at clinical reasoning skills. They may develop over time, and you may become more advanced in your clinical reasoning skills. But they are never going to be totally, definitely perfect. So the skills will also most likely change in every setting that you work in. So this could be changed based on different populations, such as like working with geriatrics or working with stroke or working with pediatrics. This will change the different like clinical reasoning skills that you'll be using.
All right, so now we've got safety habits and work area neatness. And depending on where you're working, what setting, these habits are going to be different. The work area is going to be different, but it's important that you always are adhering to safety precautions that they have at your clinical site or in the classroom, that you're aware of the potential safety issues that may arise and how you should respond to them. It's important that you're taking steps to prevent any client injuries or injuries to yourself as well, that you're conscientious about keeping your work area clean and tidy and having all of your materials and supplies put away once you're done using them, as well as assisting with the cleaning and organization of the department, not just putting that on not on the client, but on co-workers or peers that you're expecting to clean up after you. It's important that you're actively involved in that to make sure everything is safe. As well as empathy. This is extremely important, especially working with more emotional clients. Empathy is very important to show that you emotionally and intellectually understand those you're working with. Make sure that you're sensitive and respond to the feelings and behaviors of others. It shows that you're truly listening to them, considering their ideas and opinions, and validates and acknowledges the sender's communication. So that might be your client, your peer in class that's having a really rough day and they're telling you all about it. And it's important that you're validating them. I totally understand that quiz for Erica's class was so hard, and I know what you're going through. It's also important that you know yourself and what you can take and what you can give to others as well. And it's also important that you're an active listener. So showing that body language, nodding your head, yes and no, giving the mm-hms, and just that feedback so people know that you're listening. With that comes cooperation and collaboration. You need to be able to get along well with others, be friendly and outgoing, responsive to the needs of others, and able to cooperate in the workplace. You need to work effectively with other individuals and show considerations for needs of the group. After all, as OTs and health professionals, we work as a team to do the best that we can for our clients. It's also important that you develop good group cohesiveness by facilitating knowledge and awareness of others. So getting to know the people that are in your team and using your teamwork and cooperation effectively so that you can get the most out of those engagements. So we've got another couple of reflective questions here. Again, with stopping the video if you can, so that you can really think about that and answer them. So we've got, can you think of a real life example where cooperation and collaboration were not used effectively? And then can you also think of one where they were? So stop and think about that for a minute and then come back. All right, hopefully you guys came back and paused the video. For example, with me, cooperation and collaboration were not used effectively in one of our simulations we did with nursing. For example, the OTs kind of collaborated with each other and collaborated with nursing, and nursing students collaborated with each other, but we didn't as much mix. And this was actually one of our bigger simulations where we were working with multiple patients in like the observation unit. So we kind of clashed and we would bump into each other, and we weren't moving cohesively. Things were getting broken up. Patients weren't being seen at the appropriate time. Maybe they had medication that affected their ability to perform with OT. So it was very important that nursing and OT talked, collaborated, and cooperated with each other so that things meshed a lot better. On the flip side, we did have an OT and nursing simulation in the acute care setting that we did a very good job of collaborating with each other in there. So we kind of came up with a game plan, decided what nursing was going to do, what OT was going to do, what we were going to work on together, and having that game plan really made things flow super easy and made the appointment or the interaction with the client much more effective. We got a lot more out of that.
So we also want to talk about how your verbal communication comes across. So you want to make sure that you verbally participate without prompting, speak clearly, and try not to use medical jargon when talking to a patient, because that can seem like a complete foreign language to them. Just like when you mumble your words, you're talking really fast, it's harder to understand, and you want to make sure you're clear, concise, and your verbal communication makes sense. And along with that, you want to make sure that you have your body language reflecting that tone and your ability to make your point without being aggressive or unclear. So you want to make sure you're choosing your words clearly as well. This means your words that you're choosing have the intended effect and meaning when you're trying to say what you're trying to say. You're getting your point across without being unclear. You want to also, when you're talking to patients, communicate the values and learn, you'll learn the skill on how to get someone's values without asking for their politics or their religion. It's an uncomfortable topic, but you learn how to effectively communicate verbally in order to get the information that you need without being seen as unprofessional. Feedback also plays into verbal communication in constructive criticism or anything like that, where you have to give feedback and you're not just saying harsh like words. You want to be able to give something positive, give something negative, give something positive. Make sure that you're using that feedback to the best of your ability and choosing your words wisely with it. Again, verbal communication, your professional behaviors have a huge impact on how people perceive you in the clinic, in the classroom, and as a person. You just want to make sure that you are using your verbal communication to the best of your abilities. That doesn't mean swearing or that means no swearing in class. That means not, talking about drinking the night before. This is a professional environment, even though it's a classroom. You're in graduate school now, and verbal communication is very, very important. Along with the verbal communication, you also have your written communication. So this includes emails, papers, anything that you have to write down, memos in the future, things like that. Your sentences should be clear, concise, and legible, and communicate your ideas and opinions as clearly as they would if you said it verbally. To make sure that your readability is as it should be, you should have correct grammar and punctuation and only use abbreviations, because you don't want to get something that says TTYL, G2G, sounding like you are texting when it's a professional email to your boss. That's not okay, and you'll probably get talked to about it. But making sure you're taking accountability for that. So there's a record of everything that you write down. When you send an email, it doesn't go away. So if you're aware of that and you know that if you have to take 24 hours to reply to an email because you're feeling really heated in the moment because your professor gave you a bad grade on something, you probably want to take that 24 hours and reply to it in a more even way than you would if you are emotionally in the moment. So you're aware of that. Again, that documentation is out there forever, so it can be used as a legal record. So you want to make sure that you are clear in what you're saying in all your written communication, not only in emails and papers, but all of your documentation in the field can be pulled for legal purposes. So if you get called in, you want to make sure that you're documenting everything. You're making sure that you made it as clear as possible and were as thorough as possible in your documentation. Your attitude is also something that's huge and super important as a practitioner and a student, because if you have a negative attitude, you're not going to get the same response from your patients, from your classmates, from your peers, from your professors. Having a friendly, positive attitude, being open and receptive to new ideas, and being able to receive constructive feedback without defensiveness is going to help you in the long run, because you're able to be flexible and you're not going to rub people the wrong way. Being able to handle change in expected routines. So if something doesn't go your way, it's not the end of the world. An appropriate sense of humor is kind of big. Making sure that you're not using inappropriate jokes or saying something that would make sense to a 20-year-old but wouldn't make sense to an 80-year-old, where you just have to know your boundaries and what would be inappropriate and what would be appropriate. And then again, not having that negative attitude, that indifferent, arrogant attitude. No one wants to be around someone who just sucks the life out of you. You just feel like, I don't want to be around that person. And we have a ton of group work in the grad program, and having that positive attitude is going to help you work better with others.
So last but not least, we have personal/professional self. So this is displaying emotional maturity when necessary all the time. And then also balancing personal and professional obligations. So balancing like schoolwork with work or things like that. Also reacting with restraint and constructive responses. So giving responses to peers that are constructive and aren't like putting them down or things like that. Recognizing and handling personal and professional frustrations. So if you're super frustrated about a quiz that you just took, maybe just not talk super bad about it and just be professional about it and be like, yeah, I should have studied harder, instead of being like, yeah, that was totally worded wrong and this and that. Just be professional about it and try to be better for next time. Also, maybe like displaying self-composure. So if you do have those frustrations, just make sure to keep your self-composure and be calm. Also, being responsive to social cues is included in this. So next we're going to talk about some critical thinking scenarios. So we are going to give you two different ones. First, we're going to go into this first scenario, and I want you guys to pause the video and maybe write it down or even think about it in your head, what your answer would be for this scenario. So Joe is an MSOT student. He just recently started a part-time job during the spring semester. He's currently juggling classwork and working 30 hours a week. He finds it difficult to prioritize his assignments because he doesn't plan for specific time to do them during the day. So what professional behavior is the problem in this scenario? This would be organization. So this is organization because he finds it difficult prioritizing his assignments. He doesn't plan time for it. He's very disorganized, and it's hard for him to juggle this classwork with his work schedule. So there are also like some suggestions that you guys probably thought of where Joe would be more successful. So one example would be maybe making a list of priorities or having a planner to write down your schedule about certain times or certain assignments that are due and what days those are due. Also, like even scheduling just a block of time and taking the time to focus on that classwork to make sure it gets done. So for our second critical thinking scenario, we have Julia. She is a second-year MSOT student. She recently received an email from her fieldwork coordinators regarding her level 2 placement. She forgot to respond because of the break between semesters and is now rushing to secure her placement. Julia did not take the time to reread her email and check for any grammar issues or make sure what she said made sense. After sending the email, she realized she misspelled her fieldwork coordinator's name. How embarrassing. So, what professional behavior is the problem in this scenario? So we have that it would be written communication. So she had rushed to get everything done and totally forgot to respond. So without checking it, she sent it without checking for grammar or things like that. So this would be faulty in written communication. So how would you suggest Julia proceed with what has happened? So she could email and apologize instead of like avoiding the problem or making some excuses as to why she did that. The third question would be, how can she improve this for the future? So I hope you guys thought of some ideas of how she would improve. One idea is to maybe set some reminders on your phone, laptop, whatever, for when the email comes in so she doesn't rush last minute to contact that fieldwork coordinator. And that way she can reread and have time to correct any mistakes before she sends it out.
All right, so we've got some key points for you guys to remember. One huge one is that these professional behaviors are critical when working in the clinical and classroom setting. I hope we made that apparent to you guys that this is something that's very important to ingrain in your brains so that you're thinking about those things while you're in class, in the clinic, so you're maintaining that professional composure and demeanor, and so people will respect you. You'll also be seeing these professional behaviors throughout your time in the MSOT program. Like we said, they'll come up as evaluations when you're in classroom setting as well as in the fieldwork setting. Your educators will be grading you based on your professional behavior, so it's important that you guys are familiar with these terms. And also, above all, these behaviors are really going to help shape you into a competent, effective, and mature therapist. So it's not just going to end when you're done here in the program. It's going to follow you throughout the rest of your career as an occupational therapist. It's important that you maintain that ethical behavior, that you're dependable, that you're empathetic, that you've got a good attitude that really inspires people to work with you. This is going to make a huge difference when you actually get out in the clinical setting. So now we're going to have you guys apply a little bit of this to a professional behavior video. I have up here all of your names and a professional behavior next to them. So for example, Carson, you've got ethical behavior. Morgan's got dependability. Lauren has professional presentation. So if you just follow that, you can find out what professional behavior you're assigned, and then Paige is going to describe this assignment for us.
So on your to-do list, there was a link for a Flipgrid video. If you're not familiar with that, it's basically an application where you can upload like a 30-second to 1-minute video. And what we want you to do is take your professional behavior. So again, Morgan, dependability. We're going to have you record a clip of you either being very dependable, and then a clip in the same video of you being the opposite of dependable. So it's supposed to be fun. Have fun with it. It's not going to be super crazy, just 30 seconds to a minute. And we want you to try to watch a couple other of the behaviors to show, or of your classmates' videos, to show the variety of ethical behaviors and how they can be broken, how they should be rectified, and what is the best way to go about it. So it should be short, sweet, very exciting. If you guys have any questions about this, Dr. Schweitzer does not have access to this, or she has access to the presentation, but we are the ones that you want to contact with any questions or any issues with it. So you can either email Sydney, Taylor, or myself if you have any questions. So thank you guys so much for listening to our presentation today. I hope you found it valuable, because these are things that you do want to know in the future. And again, if you have any questions, please let us know. Again, I'm Paige, and we've got Sydney and Taylor, and hope you guys enjoyed.